Straightsmile Solutions, straightsmilesolutions.com. And a few of you are asking me about lower expansion, how to write up the Lapse lip. And I've done Lapse lips on pretty much everything but this, so thank you for calling me on it. So I just wanted to verbally go over it with you. Every lab is going to call things a little bit different. So I think you need to go find the lab that has pictures on the website. They say what the different types of, say, for example, they have lower screw expansion here. That's what you're looking for if you're looking for lower fixed expansion. Besides that, you want to mention whether or not, are you sending bands? Are they fitting bands? Are you taking a scan? It's got to figure out how you're going to do things. Do you want buccal tubes? That's a super important question. If you are going to use braces, then yes, you want buccal tubes. So make sure you ask for those because it's one less thing for you to do later. This is kind of your standard lower expander. Every lab says going to call it different. Some people are going to call it a different name, but it just looks like this, right? Some people don't put the rests on the premolars. Some do. Like I said, buccal tubes are always by request. So that's that. In terms of the jack screw, there are one that they call them click or one click expanders. It just means you can't expand backwards. I actually don't like that. The reason I don't like that is because it can happen where a patient is overexpanding but maybe not being compliant. Now, of course, we're talking about fixed expanders here, so they gotta be in their mouth. But you tend to happen this more in removable, where like they keep turning but they're not wearing it full time, and then it just suddenly stops fitting because they overturned it. So that's why I don't like the click expanders, because then I can't turn it back, because back turning is a big part of our process, of our SOP. Patients come in, expander's not fitting. Okay, let me see if I can back turn it. So that's why I don't like the click, but I thought I'd throw that out to you. They do make them, and for somebody who just keeps forgetting which direction to turn it and they're driving you nuts, then I guess you could always do that. All right, so this is just a version of that, but instead of having rests and bands and buccal tubes, they have crowns. Not something I would do. So the other one is called what they call a Williams. It is the same thing except for as this one, but it has a NiTi wire that's soldered there. So I guess the benefit of that is it's going to smush up against the back teeth and help push them, provide a course. And of course, you're getting more space as you expand in cases with impactions or really crowded teeth. So that's going to help. Just having space helps. Just widening the transverse creates arch in the space in the arch, so that you can align teeth. So, with that in mind, that's one way you can do it, but there's always other ways to do it as well. So it's just something to totally keep in mind. How do you want to straighten it? Do you want to put braces on afterwards? Do you just want to let them, now that you've made more space, do you want to let them go? But this Williams appliance here has a little NiTi guide wire. So when you insert it, it's going to compress that wire and help to push to make the front teeth straight. So just something a little cool. All right, hopefully that was helpful. Thank you.